morning, everyone, and welcome to today's webinar, Getting Connected, the Roles and Responsibilities of External Partners when Addressing Environmental Health Issues. My name is Elena McIntyre. I'm the Manager in Environmental and Occupational Health at Public Health Ontario, and I have the pleasure of moderating today's session. Before we begin, I want to acknowledge that today I will be learning on the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabeg, Wendat, Huron, and Haudenosaunee Indigenous peoples, land that is now home to many diverse First Nations, Inuit, and Métis people. As someone who has spent my life working in environmental health, I am grateful for the environmental stewardship of Indigenous peoples who have protected, shared, and cared for these beautiful lands since time immemorial. Following today's event, we will have another webinar in 2 weeks. And we're pleased to share that this webinar will be on the topic of risk communication and will be presented by Dr. Ray Copes. Registration details will be shared next week. We're also planning future in-person workshops, and we'll be using the online evaluation survey that is sent following today's webinar as an opportunity for all of you to help shape those in-person workshops in terms of scope and specific topics. Your input is greatly appreciated. It's now my pleasure to introduce Dr. Tamara Wallington, Vice President and Chief of Population Health, for opening remarks.
Thank you, Elena. And good morning, everyone, and welcome to today's webinar, Getting Connected, the Roles and Responsibilities of External Partners when Addressing Environmental Health Issues. Let's go to the next slide, please. Thank you. So for those of you who might be new to our organization, at Public Health Ontario, we provide scientific and expert guidance to shape policies and practices for a healthy Ontario. Our external partners and really consumers of the work that we produce is government, local public health units, and healthcare providers related to the following areas of expertise. Communicable and infectious diseases, infection prevention and control, environmental and occupational health, emergency preparedness, health promotion, chronic disease and injury prevention, and of course, our public health laboratory services. A component of our legislated mandate is to provide education and professional development opportunities for public health professionals as well. Our goal in providing these opportunities is to build skills, capacity, and competencies in Ontario's public health workforce to face tomorrow's public health issues. Next slide, please. I thought that I would take a few moments to share with you our strategic plan. For those of you who perhaps engage with Public Health Ontario on a more regular basis, you would have seen this slide before. This slide represents our new 5-year strategic plan that we launched actually a year ago, so not so new, April 2024. So this is a new and ambitious 5-year strat plan that was, of course, developed post COVID-19. And as we know, that was a pandemic that had a very profound and lasting impact, not just on the public health sector, but on our entire broader health system. This plan that I'm going to talk to you about today, just for a few minutes, was shaped through comprehensive consultations with our stakeholders from local, provincial, and national levels, as well as engagement with our staff. You will see in this depiction of the plan that we have 4 strategic directions. Deeply embedded in this plan is an Indigenous strategy that we are very, very committed to. There are strategic directions related to our public health labs. So you will see our first strategic direction is actually around analytics. So it's leading provincial public health data transformation leveraging advanced analytics to drive evidence-informed practice and decision-making. So there is a very big focus on digital and data. The second is on lab and strengthening laboratory leadership, advancing genomics for public health action, and sharpening the focus on complex microbiology testing. Strategic Direction 3, which is relevant to this webinar and the work that we're doing today around capacity building, is advancing public health and health workforce capacity and knowledge to improve population health outcomes. And then finally, Strategic Direction 4 is really anchored in accelerating and moving evidence to action as the convener and integrator of expertise on public health issues, and of course, driving quality improvement for public health and our public health sector. So as it relates to our third strategic direction, advancing public health and health workforce capacity, this is about providing opportunities for professional development and educational offerings that align with learning needs. So we're very excited to be offering this webinar today. It has been designed to support informed decision-making when navigating complex environmental health issues. And with respect to the objectives for the session today, I'll just run you through two core objectives, and then I'll hand it back over to Elena. But by the end of this session, attendees will be able to differentiate between Ministry of Environment, Conservation and Parks, MECP, regional and provincial offices in terms of program areas. And the second objective is to be able to identify program areas within the MECP that may be involved when a public health unit is managing or responding to local environmental health issues. So it's just been my absolute pleasure to provide some opening remarks today, tell you a little bit about the mandate of Public Health Ontario and our new strategic plan. And I think you have a really wonderful morning ahead of you. Over to you, Elena.
Thank you, Tamara. I'm now pleased to introduce our three speakers for today. Adam Grant is a former public health inspector who has been at the Ministry of Environment, Conservation and Parks, or MECP, since 2004. Adam began his MECP career as Water Compliance Officer and worked as a Compliance Program Coordinator before his current role as Compliance Supervisor in Owen Sound. Following Adam, we have Tim Fletcher, the current manager of the Water Standards Section and acting manager of the Pesticides Section within the Technical Assessment and Standards Development branch of the Environmental Science and Standards Division at MECP. For over 3 decades, Tim has led work on water quality, standards development, pesticides, and emerging contaminants, such as PFAS, a class of forever chemicals. Following Tim, we have Saeed. Sadia is the Supervisor of Planning and Response at the MECP's Spills Action Center. She has been with the MECP for almost 2 decades in roles ranging from Adverse Water Quality Incident Coordinator, Issues and Project Coordinator, and Area Supervisor. And with that, I will pass things over to Adam.
Thank you. Good morning, everyone. Welcome. It's our pleasure to be here today to talk to you. I'm going to start just giving you a general overview of our Ministry of Environment, Conservation and Parks and who we are. The vision of the Ministry of Environment, Conservation and Parks is an Ontario with clean, safe air, land, and water that contributes to the healthy communities, ecological protection, and environmentally sustainable development for present and future generations. The ministry develops and implements environmental legislation, regulations, standards, policy guidelines, and programs. Its research, monitoring, inspection, investigations, and enforcement activities are integral to achieving Ontario's environmental goals. Each new government determines how its environmental plan will fulfill the ministry's mandate and what its priorities will be. Our structure. So let's have a look at how our ministry is structured. At the top, we have the Deputy Minister's Office, which provides direction to the ministry and works with the Minister's Office to ensure that the programs are delivered effectively It also includes legal services and communications, which provide services to the other sections of our ministry. The Environmental Sciences and Standards Division provides scientific monitoring and testing and develops standards to inform policies and compliance activities. We have the Climate Change and Resiliency and our Environmental Policy divisions. They provide a focus on developing policies and programs to achieve environmental outcomes. We have our Environmental Assessments and Permissions division. They conduct assessments and grants permissions to industries and public for various activities that may impact the environment. And we have the Drinking Water and Environmental Compliance Division, which ensures that the community we regulate is compliant with environmental legislation and processes to ensure public health and protecting the environment. And then we have the Land and Water Division. They help to conserve, protect our diverse resources, including species at risk, provincial parks, source water in the Great Lakes, inland waters. And finally, we have our Corporate Management Division, which supports all the other divisions by managing our money, our human resources, our facilities, and technology for the ministry. So let's see, we're going to look at how we work, our unique ministry processes and partners and initiatives. Our ministry partners with a number of organizations to deliver our mandate. First, we have agencies, boards, and commissions. Agencies are short-term bodies such as an advisory committee or a panel on task force, are arm's-length organizations that help Ontario government deliver its services to the public. The ministry is accountable for agencies, advisory councils, and various scientific committees. Here you can see two examples of these. On the left, we have the Ontario Clean Water Agency, which leads the operation and maintenance and management of water and wastewater treatment facilities, distribution and collection systems on behalf of municipalities, First Nation communities, institutions, and private sector companies. On the right, you see the Walkerton Clean Water Center, who deliver education and training for owners and operators and operating authorities of drinking water systems. Other partners and regulatory ministries include our Ministry of Natural Resources and Forestry, Agriculture, Food and Rural Affairs, Energy, Public Health, Long-Term Care, Labor and Immigration, Training and Skills Development, Transportation, and we have Municipal Affairs and Housing, Colleges and Universities, Children and Community Social Services, Solicitor Generals, Finance, and the Government and Consumer Services. And we also partner quite extensively with universities for research, other governments like the municipalities and the federal government, especially with issues like the Great Lakes and air quality management. We partner with conservation authorities, industry groups like the Canadian Manufacturers and Exporters, the Waster Diversion Ontario, source protection committees, environmental and community groups, such as the Asthma Society. We have a lot of educated staff, engineers and technical staff. Ministry is a very diverse ministry with respect to positions and opportunities, lots of opportunities in our ministry. We're going to look more now at the specific information about some of the parts that you as health inspectors will eventually interact with. We're going to start by looking at the Drinking Water and Environmental Compliance Divisions, regional and district offices, followed by the Spills Action Centers and the Environmental Science and Standards Divisions. We'll each take time to give an overview of our portion of the organization and how we work with health units. The Drinking Water and Environmental Compliance Division is responsible for protecting and supporting clean air and water and is responsible for provincial oversight and delivery of compliance and enforcement programs It delivers modern risk-informed approaches to improve compliance and environmental performance of the regulated community, ensures environmental protection. Let's talk about our regions. As you can see, our offices are broken out into 5 regions. We have Central, East, North, Southwest, and West Central. Each region is led by a director and an assistant director. The director's office acts as the lead for the regional and district offices. Each region includes technical support section, a program services section. Staff also include a regional issues coordinator, a senior communications advisor, and business and administrative support. The staff of the technical support section provide a variety of applied environmental sciences to district staff, other ministries, branch and staff in various ministries and agencies. These services can include activities such as reviewing environmental assessments, air quality analysis and monitoring, biology, hydrogeology, hydrology, planning and geographical information systems. Technical support may also undertake sampling activities to support district compliance, assess threats to public health. They audit industry operated sampling programs and assess contaminated site impacts and cleanup, and approve various permits and control documents. You may need to take environmental samples to assess public health and environmental health. Technical support staff can assist. All tech support services are accessed through the district offices. All requests for support are evaluated on a case-by-case basis. The district offices. The district offices ensure compliance with the ministry standards and legislation. Staff are responsible for performing inspections, responding to complaints, and approving permits. Our district engineers oversee high-risk environmental abatement projects and can provide initial technical support when needed. All legal actions are initiated by the district. We provide education and outreach activities to inform the public and the regulated community of ministry programs. The kind of staff you can expect to see in the district office include environmental officers, water compliance officers, district engineers, issues and project coordinators, and district supervisors and the district manager. Let's finish off with looking at the usual issues we will likely collaborate on. Our compliance family is divided into 2 teams, environmental compliance and water compliance. Each team leads various compliance programs and issues. Some issues that arise require both teams collaborating, and determining the lead is evaluated on a case-by-case basis. So with the environmental compliance issues, they usually deal with the spills with potential health hazards. You'll interact with them. Offsite impacts creating a potential health hazard. Of course, our blue-green algae issues. We have air quality and private septic systems. And sometimes, a lot of times, any issues that may require technical support or environmental standards and science division, specifically a lot of times toxicology. With water compliance issues, we interact a lot with municipal water quality, municipal wastewater and bypass overflows, designated facilities such as the schools and children care and healthcare water quality, municipal year-round residential or water quality private well complaints. So there's a lot of things that we do interact with the health units. At this time, this concludes my portion of the presentation, and we're going to hand it over to Tim for Environmental Sciences and Standards Division.
Thanks, Adam. So you sort of seen where we fit into the whole overarching Ministry of Environment framework. So my hope here is to provide a little bit more detailed information on exactly what ESSD does. You saw it mentioned a number of times in Adam's talk. We have a lot of crossover between the two divisions and support across the ministry. So we generally we say here the bulk of applied science with respect to the ministry's science-based decision making. You saw that there was a lot of science being done, particularly by tech support sections within DWEC-D as well. So we work quite well together. We tend to deal with sort of larger picture programs or studies, and then support tech support and our approvals programs with more complex science when needed. The division itself is broken down into 3 branches, which plan is to go through and explain where those crossovers between ourselves and the Public Health Ontario occur, and provide a little bit of resources to you on where you would contact to get information or who you would contact to get information. So the 3 major branches within the division is our environmental monitoring and reporting branch. Our names are fairly self-explanatory. Their role is to go into the environment, take samples from environmental media, could be air, water, soil, biota, etc. And once through analysis, look for trends of contaminants in the environment or look for concerns where contaminants may be exceeding standards, etc. We have a fully operating laboratory currently at 125 Resources Road in Toronto, and they handle the bulk of the analysis that not just the ministry requires, but also we support some of our partners in doing work for them. And then the branch that I work for, Technical Assessment and Standards Development Branch, developing a wide range of standards for environmental media, as well as a wide range of guidance. And then the technical support side, which is providing expertise in areas such as engineering and toxicology. We support emergency response for environmental monitoring and for analysis as well. The information we develop is used internally, but is also used by other government partners. We participate in a number of federal, provincial, territorial committees, so the information is shared across Canada. We work with US EPA and other international jurisdictions when they're available, and then work with our academic partners to understand some science issues better. So the process within the division and throughout the ministry is, of course, a cyclical process of measuring contaminants and other things in the environment, understanding their relevance, what the impacts, what the concerns may be, doing analysis on trends, etc., determining where there may be problems, high concentrations of problematic chemicals, for example, and then developing standards and guidelines about what safe levels in the environment may look like, and then working with other partners on actions and policies and regulations that may reduce the presence of these contaminants in the environment, and then go back to the beginning, do more analysis, determine whether those activities are having an impact in the environment, and going through the process again and again. So the environmental monitoring program, we have, as we say here, 15 province-wide programs looking for baseline conditions and environmental trends. And then we supplement that by doing special studies across the province, working with our regions and districts to work on specific projects, site-specific projects that may be of concern. We monitor for a wide range of contaminants in a wide range of media, and continue to develop new methods for sampling and new methods for analysis to move our information forward. Monitoring has a number of goals. As we said, it can be used for state of the environment reporting. It can be used to determine whether or not remediation is working, whether abatement and compliance activities are working, whether additional work is needed. In addition, we have real-time data stations across the province, groundwater wells where we may take samples for contaminants to understand trends in the environment over time, but also have real-time water level monitoring. So we don't have to visit those wells to get this information. It comes to us. The same with 4 buoys in 2 of the Great Lakes that take a number of readings about typical water quality parameters, like suspended solids or phosphorus, depending on the buoy in question. And that information, again, is able to be uploaded to the ministry's office and now analyzed without having to go visit them on a daily basis. Even more remote and therefore harder to get to are the carbon flux monitoring stations in the far north around the Ring of Fire, which continues to be a mineral development area or a planned mineral development area, as well as the Hudson Bay lowlands and concerns about peat loss over time. Those are really climate change factors that we're looking at. And finally, a number of air monitoring stations across the province, particularly along highways, to understand particulate matter and other chemicals in air. We have a number of programs that we rely on citizen science to help us with. So it's particularly the inland lakes lake partnership program, where the volunteers take samples or take recordings of water quality clarity and providing that to the ministry so that we have a good understanding of a number of lakes in the province and which we would not have the resources to visit within the ministry itself. And the same with our fish contaminants program, which I'll talk a little bit later. Collecting fish from almost 3,000 sites across the province, not on a yearly basis, but on a cyclical basis, working with M&R to do fish collection, to analyze contaminants in fish and better understand potential health concerns with consumption of those fish. With respect to how we have linkages from the environmental programs with the public health units, we would point to the raw water chemicals map. So I noted that we have the provincial groundwater monitoring network, which is visited, and they take water quality samples on a fairly regular basis and have them analyzed for a suite of predominantly metals that could be of health concern. And if we detect a value or a concentration in one of our monitoring wells that exceeds an Ontario drinking water quality standard, there is a notification of public health units that this is occurring. And this is raw water, and this is not in a well that is being used for consumption, but it is an indicator that that the aquifer may be used for as a drinking water source. And so it provides some measure of information to ourselves and yourselves on whether there could be problems. Similarly, with the air quality monitor network, that information is real time and develops metrics such as the Air Quality Health Index, the AHI, to indicate whether or not there is potential health risks with the air quality at a given time and how air quality changes over time. With, of course, the more frequent wildfire issues in the north, we've been developing better health messaging and ways of analyzing air quality in those locations to help support you and others on potential health concerns. As I mentioned, there's the Guide to Eating Ontario Fish, which you can access at our website, that looks at a number of potential contaminants that could be of potential health concern, and the guide indicates what a safe level of consumption of certain sized and certain species of fish is for a given area. and identifies which contaminants are of most concern. Generally, they are PCBs and mercury, but we are starting to see PFAS being a driver for a number of locations in the province. If you are interested in particular lakes in your public health area and want to be notified when these guidelines are updated, you can contact that email address and ask to be notified. And finally, we do a lot of beach quality work with the local PHUs in support of Lake Simcoe protection plan. So looking at beaches around Lake Simcoe and keeping sort of a more lake-wide understanding of beach water quality in that particular location. And we do similar kinds of work with a Great Lakes focus. So as I mentioned, the laboratory, full service. It's got accreditation for drinking water samples, et cetera, fully CALA accredited. We can do up to 1,400 parameters for including developing new methods for emerging contaminants, such as more PFAS, tire wear chemicals, et cetera. And we can do a number of different types of media for analysis of, again, biota in fish and water, both drinking water and surface water, et cetera. We have experts on site in microbiology and analytical chemistry, molecular biology, new molecular biology tools, and we have a toxicology, an aquatic toxicology unit that predominantly looks at compliance for effluent regulations, or in case that there are spills, whether concentrations of contaminants are going to be lethal for fish, and then the regulatory programs, especially for effluent limits, to ensure that that does not happen. Finally, we mentioned the fact that we have the mobile air monitoring labs, the TAGAs. So these are vans or larger trucks that have environmental or have analytical machinery within the trucks themselves, and they can drive around of specific locations, monitoring air quality in real time, identifying concerns in case of a spill, an air emission, or even sort of longer term issues related to air quality. Again, we have these contacts with Public Health Ontario labs. They noted many of the same kind of things that the PHO labs we've done. We've had, during the pandemic, we were doing water quality, drinking water E. coli testing for them to help alleviate some of the burden. We are a resource to the public health units if they have concerns about specific contaminants in that they're seeing perhaps the cause of a health concern. You can work with our customer service at the lab and have testing done to see if the contaminants are a problem. And the example is whether you're concerned about lead in pottery or jewelry. Those are things we've dealt with before. You are probably all very familiar with the drinking water program and what to do when there are drinking water exceedances. We certainly know who we contact within your organizations if we know of a standard being exceeded, et cetera. And again, as we've mentioned over before, the blue-green algae, the harmful algal bloom conditions, and the work we do with our local MECP regional offices and within our own division, and then the work we do with yourselves. And then finally, the work that I do and the group that I'm in, standards, which could be regulatory standards such as air quality standards, drinking water quality standards, record of site condition standards, but also non-regulatory standards such as provincial water quality objectives. And we also do a lot of technical advice documents like drinking water systems, engineering advice, stormwater engineering advice, et cetera. And then guidelines related to a number of different programs within the branch. So brownfields, pesticides, nutrient management, air odor control, and air emissions. We work heavily with PHO. There's standing meetings monthly with PHO, with Elaine and Elaine's group, talking about higher level issues of contaminants in the environment and specific issues about contaminants in the environment to make sure that we're all on the same page. We work together to develop risk communications material and providing advice to the public health units when there are concerns about contaminants in the environment and exposure and what the potential impacts are on human health. We provide, a lot of the time, the district office is the first point of contact for the public health units, and we feed into the district's staff to provide information. And then we work with both yourselves and anybody else involved in the drinking water community, where we have concerns about contaminants in the regulated drinking water systems, particularly when we are seeing exceedances of Ontario drinking water quality standards. So that is the work of the division in a very short period of time, and I'm happy to turn it over to Sadia to talk about the Spills Action Center. Thank you.
Hi everyone. Yeah, I am Sadia Saeed. I'm one of two supervisors at the Ministry Spills Action Center. So for my portion of the presentation, I will provide an overview of what the Spills Action Center does, our primary functions, what we do in terms of notifications, the resources that are available to us, and what happens after we get a spill report. So on this slide, this is what Spills Action Center looks like. It was created in 1985 in response to a few major events, specifically the 1979 Mississauga train derailment, which caused huge environmental and human health impacts. And then so the incident displaced over 500,000 people back in 1979 and highlighted the need for a rapid response to environmental spills. So out of that event, Part 10 of the Environmental Protection Act was created, and Part 10 is all about spills and reporting and who is responsible for what. So when Part 10 of the EPA came into effect in 1985, the Spills Action Center stood up as a 24/7, 365 operation as a crucial incident emergency contact center. So that's our history. At this time, we have approximately 28 officers who are designated as provincial officers. So anytime you call into Spills Action Center, you're speaking to a designated provincial officer. And because Spills Action Center is considered essential service, we can never be down. We don't have voicemail because we always have to have a live person answer the calls. And because of that, we have certain backup redundancies capabilities. We have evacuation locations, we have a backup generator, and we are able to be operational at all times. Okay, so I won't go into each of the pieces of the legislation noted on this slide, but the main pieces that we interact on a day-to-day basis is like the one I mentioned, Environmental Protection Act, Part 10, the Safe Drinking Water Act. We do take a lot of adverse water quality incident reports, and I know that that's a piece of legislation that we overlap with public health units. Our primary function is, I'll go over this in detail. So we receive information for an event, we coordinate the response. We also serve as the one window reporting for environmental events in Ontario. So what that means is that when an event is reported to SAC, it also is passed on to Environment and Climate Change Canada. So every day we roll up a summary and it is sent to Environment Canada. And so if anyone or someone is reporting to SAC, they're also fulfilling their reporting requirements to Environment Canada. Other functions that we perform include internal staff tracking of our staff. We also have other resources that are available to us, like CanUTech. That's where we get our information on chemicals. We have an internal mapping tool, which was designed for the Spills Action Center. So it has a few more layers in the Source Protection Information Atlas that is public facing. In terms of we gather all the information, we assess it and coordinate as appropriate for the response. We have triage tools and matrices to help our officers determine that. And this includes assessing the information against our procedures. At times we follow up with other agencies and we need to make certain notifications. We perform that function as well at SAC. We also receive information from our field officers who are out there doing their field work, attending a spill or another environmental event during business hours and after hours. And then the field officers keep Spills Action Center in the loop so that we can continue to feed information internally, but also externally to other agencies as well. So sometimes that could look like providing information to the municipality, to the health unit, and any other agency that may need to become involved. We also have some real-time air monitoring capabilities and air and water modeling. We have our environmental monitoring and reporting branch that we can draw resources from for such monitoring and modeling. But in the after hours, we can access Environment Canada to help with that. They are able to stand up a little bit quicker when it comes to asking for air and water modeling, but it has to be like a big event at that point. So several other folks, several other agencies would likely be involved, and including our on-call management. Okay. So in terms of, like I mentioned earlier about notifications, we have a lot of notification agreements. We do a one window reporting for Environment Canada. We also have agreements with neighboring jurisdictions like Quebec, Michigan, and New York. This underscores the importance of how SAC is kept in the loop. We have a really great province-wide overview of what's happening at any point in the day. So that's kind of the fun thing about working at SAC. You can always fulfill our notification agreements. And depending on the event, Spills Action Center can also notify and coordinate with other agencies to provide a response. These agencies include, but are of course not limited to, the health units, Indigenous communities, drinking water systems, etc. The notifications are really important, as the health units and fire departments are the only two agencies that can declare an evacuation and shelter in place to keep the public safe. And so that's why it's important to have those relationships in place for us. Additional resources, as I mentioned, we have a great internal mapping tool and internal modeling capabilities and utilizing Environment Canada as well as for bigger events. We have our triage tools and many procedures. We also have backdoor numbers for over 470 municipalities across Ontario. So what that means is when the Spills Action Center gets a call or calls those municipalities, actually, we're able to get through a lot quicker. So we're not waiting in queue with the general public. So when there's an emergency going on, we're able to coordinate quicker. I also mentioned earlier about CanUTech. They are staffed similar to Spills Action Center, operating at 24/7, and have a bilingual chemist who provides information on chemicals and how best to respond if one of those chemicals are released. For example, they can help us relay information to the fire departments and say, like, yes, apply water, or no, apply foam, depending on what the chemical spilled is. Okay. Other resources available to us for use is the trace atmospheric gas analyzer that Tim mentioned earlier, which is a mobile unit. The fire department can request the ministry for such research and monitoring, or also do like real-time monitoring if there is an active event that is impacting the atmospheric chemistry in the area. So it can drive around a neighborhood during a big event or release. We also have laboratory information for our field officers for the sampling work that they would need to conduct. We have technical support and expertise that we can draw on to provide feedback to the fire department and health units. And this information will help those agencies to make timed decisions about evacuations and shelters in place when they can be lifted. So what happens after? I won't go too much into this slide because I know Adam kind of went over it, but essentially we have 25 district offices across the province, splitting up into 5 different regions. So when our ministry responds to a spill, our officers are out there working with multiple levels of government and our agencies to assess the extent of the impacts to the natural environment, to enforce our mandate and legislation, as well as to provide advice or direction on required actions such as containing and cleaning up the spill. Our officers are also in the field collecting information through interviewing the people on the scene and taking samples and pictures. So as those officers are responding during business or after hours, they're feeding information back into the Spills Action Center, and then we at SAC make those necessary updates to the notification per the notification agreements. So because we're expecting our field officers to be focused on their field work, Spills Action Center is the one behind the scene in terms of communicating with all parties involved. Okay, so once the immediate spill event is done, the file is transferred to the ministry's district office, and the area officer continues with the longer term follow-up of the event to ensure the spill is appropriately cleaned up. And sometimes they'll collect back with and coordinate with the local municipality and or the health unit if they need to become involved. Okay. And essentially that's the end of my presentation. These are the various ways you can contact the Spills Action Center and the different ways you can reach us for different reasons. If it's a spill or a pollution event, for members of the regulated community, they do need to report through our spills line. And then if you're a member of the public, you want to go through the pollution hotline or the online reporting portal. Okay. So I'll pass it on back to Elena now for Q&As.
All right. Thank you to Adam, Tim, and Sadia for that thoughtful and informative presentation. And also delighted that we now have quite a bit of time for Q&A. For this Q&A portion, we're pleased to welcome a panel of experts from the MECP who are going to bring their regional insights and experience to our conversation today. As I introduce our panelists, please take this time to now submit your questions using that Q&A pod at the bottom of your screen. With us today are Renee Bélanger, Acting Divisional Program Specialist in the Sudbury Regional District, Shannon Boland, Divisional Program Specialist with the Northern Region in the Drinking Water and Environmental Compliance Division, Ashley Boucher, Project Manager in the Central Region, also with the Drinking Water and Environmental Compliance Division, Dustin Ellis, Acting Divisional Program Specialist with the Eastern Region, and Scott Gass, Acting District Manager at the Owen Sound District Office. Thank you all for joining today. Now, one of the advantages of being moderator is that I often get to ask the first question. And so to start things off, I'm going to ask for each speaker, what is one thing that you wish our local public health units knew about the MECP?
I can start answering this one. I was a public health inspector many, many years ago, and I'm a little bit familiar with the way things were back then. Maybe not so much now, but one thing that I do want to get to come across is that being part of the ministry, being part of the provincial government, our government has a huge hunger for knowledge and in being kept informed. And we call it issues management. When we're constantly having to feed our deputy minister's office and our assistant deputy minister's office with information as events progress, and it's important that we get information and accurate information to them in a timely fashion so they can speak to the press, they can inform the minister and provide all this information in a very timely fashion, and at times help combat misinformation that might be going on. And a lot of times our district offices are going to be sending you requests for information, and it's really important that you guys provide us with that information in a really timely fashion. And it helps us to keep the issue contained and provide a reasonable response to things. We have huge amounts of teams of people that when we have a big issue, like if we have a boil water advisory on a big municipal center, we need lots of information all at once, and it's really important for us to get that out quickly and that we stay on top of it and manage it appropriately. So that's my big thing, is if you can, when asked for information, that you do your best to get us that information as quickly as possible.
I can go next with my input from Spills Action Center. Yeah, I share Adam's sentiments for communication back and forth. I'll just add that, you know, if there's any information that's needed from the ministry in terms of notification requirements or contact information, Spills Action Center, you can please reach out to us. We likely already have contacts and details for you, and if ever needed and urgently, we're 24/7. Reach out anytime.
So for us, you know, I think just highlight that we have a number of experts in a number of different areas within the division, engineers, scientists, toxicologists, water quality experts, and we're certainly available to assist, to provide information. But I would say that generally the best way to do it is to work through your local district or regional MECP staff, and they can come to us and engage us, or go through PHO. And as I said before, PHO and ourselves meet on a regular basis. So, you know, the importance is that using a one window approach means that you're going to get consistent information from us, and that information will be not just consistent to you, but to your associated PHUs across the province, so that you're not getting different information from different people.
I can go next. Mine would be just the benefits of an effective working relationship. And I say that as for years I was an inspector in the field, and I was fortunate enough to have a really great relationship with the local health unit. And there were issues that came in where they were the first, you know, eyes on the site, and they would let me know, and then I became aware of things. And then there were also times where that was vice versa, where I would come across something that would fall more into their jurisdiction. And it just turned out to be this really great, effective relationship. And it was just beneficial for both of us. Because again, as Adam mentioned, sometimes we have issues management, and I'm sure there might be times where you need information from us as well. So just to have those relationships established just is really great for all parties involved.
And I'll just add to that I just, because this may be something that you guys may not be aware of, we actually work quite closely with our counterparts at the Ministry of Health as well. So particularly on the drinking water side. So we'll kind of talk about common issues. We meet regularly. So, and sometimes also like on the lab side as well, if there's any lab issues, because our lab compliance group, their scope includes the 170 systems as well as the 319 systems. So just an awareness that we also have that ministry level collaboration as well, which, you know, isn't always the case, but I do think especially on the drinking water side, we do have a really good relationship with Ministry of Health. So just to be aware that there are conversations that happen at that level as well, and that relationship is available if it needs to be leveraged.
I'm just going to add, I guess at the district level, I guess ministry's primary focus is on industrial and commercial sources of pollution. While we do sometimes become involved with a lot of residential pollution sources that can impact a broader environment, such as spills that impact offsite properties. There's a lot of scenarios that like sources of air, odor, smoke, dust emissions relating to, for example, residential home heating or open burning. Open burning is another example that comes to mind that you know, better dealt with through the municipality or possibly the fire department or other regulatory or permitting authority, basically, which isn't generally the Ministry of the Environment. That goes for other residential sources of noise, I guess, or I'm just trying to think of other things that come to mind. I guess residential sewage systems as well is another example. We're not the permitting authority. That's generally the it comes under the Ontario Building Code and goes back to it and goes to the municipality. So we do sometimes get involved. Again, larger issues when that's offsite impacts or impacting an aquifer or pollution sources. But again, that's generally referred back to the municipality or permitting authority.
I guess I can go next. Hi, everybody. I'm Dustin. As they mentioned before, I'm sort of act as the compliance lead currently for the private well program and the wells program and for the harmful algal bloom response program. And so I'm just going to mostly echo Shannon's comments, and coming from a background as a district officer as well, just the value of having that communication and collaboration at the local level. You can imagine the programs that I'm responsible for, there is a decent amount of overlap between the two agencies. And we found that some of the most successful situations are in the districts where there is good communication and between the two groups, between the local health unit and the district office, where they know each other. When I worked in the Kingston district office, they had sort of annual meetings between the two groups, between the district and the health units that corresponded with them, and those provided, from our perspective, a lot of added value. So we are all on the same team, even though we may not always have the exact same scope of work. It is valuable to sort of find areas where we can collaborate, and it will hopefully make both of our jobs more efficient.
Okay, thank you to everyone for sharing on that question. We'll now start to go through the questions as they've been submitted. The first one is regarding the recent ice storm. Were the 170 systems reporting to MECP following that ice storm? Does anyone know?
I'll take that one. Generally speaking, a power outage is not considered an adverse water quality incident. So it's not technically legally required to be reported. However, we have communicated in the past, I don't know, maybe it was 2 years ago now, or was it 2022? The last time there was a major storm out that way, we did actually send a memo to all the system owners to, asking them to proactively report if they're experiencing power losses, just so we're aware of kind of capacity issues and whatnot. So generally speaking, I would say that most do let us know when they have extended power outages. Sometimes they are required to report if it results in a loss of disinfection. That is a reportable adverse water quality incident. I did speak to the Peterborough supervisor last week based on a different question that someone asked me, and I know that he told me there were lots of boil water advisories in place across his district. So obviously that tells us there's a level of communication there. So I would say, generally speaking, they tell us about it, but just power outages in of themselves are not technically required to be reported by the legislation.
We also have a question that has come in, and I think this is really just a point of clarification for Sadia regarding your slides.
Sure.
Who did you say were the only agencies who are able to issue a shelter in place?
The fire departments and the health units.
Perfect, thank you. And this next question, I believe, is for Dustin. Are there any plans for MECP to start disclosing positive blue-green algae blooms on the website or in a public way?
A great question, the million-dollar question. So I think there's sort of two parts to that question. The first part is to understand sort of what our role is when it comes to blue-green algae response. So technically speaking, our role is to gather and assess technical information, technical and scientific information, which we then provide to the local health units to make public health decisions. So when we're collecting sample information, we're typically, and as we go through the process, whether it's samples or photos or visual identification, our role is to make sure that we're providing that in a timely manner to the necessary stakeholders, which typically is health units primarily, and then secondary would be municipalities and in some cases conservation authorities if they exist there, and other agencies if there's a reason to. We are not typically the agency that does public notifications for blue-green algae. That we actually defer to the health units on. So that's the piece where like our process is that we report it to the health unit and they determine how they want to report it to the public. In a broader sense, it is fair to say that we do not actively publish the data currently on our annual blue-green algae sampling that we do. And there's a few varying reasons for that, but one of the main reasons I think is that the data, first of all, there's some privacy concerns about locations of data and what information is actually collected as part of the data collection, and sort of the condition that the data is in. I think there's been ongoing discussions back and forth about whether this will eventually become public or whether it will not. We can always provide it upon request, but we don't actively publish it, partially because we have to sort of do quality assurance and control sometimes with the data if we were going to publish it in any meaningful way that we don't actively do right now. I don't know if that answers the question. I hope it does.
Can I just add to that?
Please.
The other aspect of it too is that the Ministry of the Environment, we don't comment on health related information, and so even though we get some bodies of water that have blue-green algae or harmful algae blooms reported, sometimes they're not considered for various reasons, not necessarily a public health concern at that time. And it's up to the health units to determine that. It's not up to us. Now, Ministry will provide support to help make those decisions, but we don't make those decisions. So it only makes sense that the health units be the ones to report those and report the ones that are significant, and not us. From that sort of.
Yeah, thanks for clarifying, Adam. That's exactly right. Is that we take sort of the line for us is we're collecting scientific information so we understand what's happening, and our job is to provide that to health units for them to make a decision on how they want to address it and publicize it. And I'm not sure if this is the forum. I know, Elena, you and I have talked in the past a little bit, but there is going to be another seminar coming down the road a little bit, specifically focusing on blue-green algae that will hopefully help to kind of put some of this information in better context.
Thank you for that plug, Dustin. Yes, and for the health units who are joining us today, you'll be hearing more about 2 webinars in the coming months. Those will be in June, just in time for the cyano season. Okay, one thing I wanted to follow up on, and Dustin, this is something you mentioned, the conservation authorities. So it's often not clear how the conservation authorities work with or report to the Ministry of Environment, Conservation and Parks. Is it possible for someone just to provide a bit more of a description and a bit more detail on how that relationship works with our regional conservation authorities?
I can flag that. So we actually, even though conservation's in our name, I think so. Conservation authorities have sort of been shifted back between us and the Ministry of Natural Resources. So they were actually with Ministry of Natural Resources, but they've just returned to our ministry's profile after the last election. So I'm not sure that, there's kind of reestablishment of roles there. I know, though, they do, from a drinking water source protection perspective, I know our source folks, they do communicate with the conservation authorities regularly for that particular program. So I don't know if there was something specific you had in mind or if it was just a general question, but I think that's kind of the status right now.
That's definitely helpful. In terms of the questions that are coming in, so we do, of course, have some gratitude for the presentations and for everyone sharing their time today. So again, thank you. And then kind of a general question. What would be an effective way PHUs, public health units, could go about introducing themselves to the local, MECP contact? Is there a process? Is it formal or informal? If you could speak to that a little bit, that would be very helpful.
I can start on the drinking water side. You may be aware in the Ministry of Health Safe Drinking Water Protocol, it actually says in there that the public health units should meet with the Ministry of Environment Water Compliance staff twice a year. So that's actually in that protocol. And so typically I would say those meetings are led by the water compliance supervisor. So for drinking water, if you want to just like get an introduction, I would say that the best thing to do would be to go through the water compliance supervisor that is in your region. And we do have a district office locator on our website that you can find if you're unsure of which office is tied to your region. Or we could probably do some kind of list for you if that's something people are interested in. And then I will let someone else speak to the environment side, but I would say on the drinking water side, for the kind of introductory purposes, you would go through the supervisor. Over time, I think inspectors end up communicating one-to-one for when there's adverse water quality incidents and that kind of stuff once they kind of get to know who's doing what. But in terms of the initial introduction, I would say the supervisor is the best bet.
I'll just step in terms of the environmental compliance side. I don't know if there's a formal process in place, but open to anyone, any public health unit reaching out anytime. Here in Owen Sound, we're pretty lucky. We actually work right in the Grey Bruce Public Health Unit building, and we interact quite frequently with the local public health unit here. But and I can say that for the other public health units in our area as well. Generally, we get involved with one another. Just in dealing with recently with some PFAS issues, and offsite impacts, I guess, related to sewage systems, and private residential wells are a lot of what we do with back and forth here in our district specifically. But and I know that every district's got their own specific issues and public health units as well. There's a lot of conversation back and forth, but I don't think there's a specific process in place, but by all means encourage anyone to reach out anytime.
Thank you. For our next question, I'm going to call on Tim. So Tim, you mentioned PFAS and how they're becoming a greater concern with regards to fish consumption. I'm wondering, can you give a quick kind of update on some of the things that you're doing currently to look at PFAS in the environment?
Sure. So I think some of you may be familiar with a study we started a number of years ago looking at landfill leachate, knowing that PFAS is associated with a number of sort of consumer products whose eventual demise is in landfills, as well as industrial contaminants or disposal of industrial products. We knew that PFAS was mobile, and we've been working on a study to see what kind of hydrogeological conditions may result in PFAS leaving a landfill and impacting drinking water. In most cases, it's probably a private system that is located close enough to a landfill to be a problem. And we're working on some guidance on what kinds of conditions one should look at for that to be a concern. Also realizing that in Ontario, a major source of PFAS in the environment is probably through the use of aqueous firefighting foams, either as part of a fire, control of a fire, but also perhaps by previous training lessons or cleanouts of equipment at fire halls. So we've been started a project this year, last fiscal year, looking at regulated systems within about a 2-kilometer radius of fire halls, testing drinking water to see if PFAS could be seen as elevated, and again, trying to determine the risks of these kinds of land uses. And that project will continue as we sort of knock off other types of industrial uses associated with PFAS. So metal refinishing, pulp and paper, and trying to understand the potential prevalence of PFAS particularly in drinking water in that case. And I would preface all that with, we all hear really scary stories about PFAS in the environment coming from the US. And they are having, many states have huge problems with PFAS contamination because they produced large amounts of PFAS with poor hygiene originally. And they also produce lots of consumer equipment like frying pans and nonstick hiking gear that used PFAS. And we did not have high scale production of PFAS in Canada, and we don't have high scale production of these kinds of materials either. So we just do, so far in the environmental programs we have, surface water, groundwater, drinking water, we are not seeing the kinds of levels that you can see in the US. We have a few locations in the province that have been identified, and they tend to be associated with airports and the use of firefighting foams on airports or military bases, and then perhaps some local issues where there has been a fire where AFFF has been used and has caused contamination. How's that?
That was great. That was great. I have received another question, a follow-up for you, Tim, and I think it's one we might have been anticipating. Regarding PFAS, now that Health Canada has come out with their number, wondering if Ontario has an ETA for when a number may be released.
No, I don't have an ETA. I'm hoping sooner than later. We have sort of suggested above like what a path forward could be. So again, one of the things to note is that we have existing interim advice of 70 for 11, stressing the word interim, and also noting that Health Canada's number is an objective. It is not a health-based maximum acceptable concentration, right? So is that value appropriate to be turned into an Ontario drinking water quality standard, which tend to be health-based or are health-based? So probably not the best avenue to go on. But certainly, I think it's fair to say we've all seen as more scientific information on the health impacts of PFAS come around, the numbers are getting lower and lower. And so certainly looking at any situation where you could reduce the presence of PFAS, particularly in drinking water, is advisable. Both our current interim advice and Health Canada's objective also stress the concept of ALERA, as low as reasonably achievable. We know that there are readily available, not particularly expensive, unless you're talking about a big system, treatments that are available that will reduce PFAS concentrations well below 30. And so, if you are seeing levels that are higher than background, that should be a consideration on treatment.
That was great. Thank you. The next question we have is about the 170 systems. So what is the MECP role when a 170 system reports an AWQI, and what is expected from a local health unit in these situations?
All right, so just very quickly, so when an when AWQI happens, so the operator is required to report to the Spills Action Center, to the public health unit, and then possibly other people depending on what type of system they are, but we'll just focus on those two key ones. So when that comes into our Spills Action Center, our lovely staff there, they create the incident, they'll send it to the local office. If it's something of a more serious nature, we have a matrix in place. They will flag it via a phone call. So like, for example, a high E. coli, like that's a phone call. So, so that's kind of how it works from a reporting perspective on our side. And then inspector will then, they're responsible for following up on the adverse water quality incidents. So they have a few things that they'll do. If it's really serious in nature, or if they're concerned about it, they may do a site visit. They may go take an audit sample, depending on what it is. So those are actions that could happen, but those are, I would say, are probably more rare these days. But then the other pieces is that they'll follow up to make sure that the operator is following the required corrective actions that are outlined in 170. So typically that's resample for most of them. If it's tied to improper disinfection, that's restoring the disinfection. So that could be increasing the chlorine. And then they will follow up to make sure they submit the required paperwork. So there's the 24-hour first notice of what they're going to be doing. And then there's the notice of issue resolution, which is required to be submitted within 7 days from the incident being resolved. So it's kind of the broad picture of that. And then so on the flip side, when the operator is calling the health unit, the expectation is that the health unit is going to evaluate the incident and decide if they feel that they need to issue advice that goes above and beyond what the regulation requires. So, and I just want to make this point, as a health inspector, you cannot tell them to do something that is counter to ODA regulation 170. So if it says to sample at the site upstream, downstream, you cannot tell them to take fewer samples. So I just want to make that point, because we have had that situation in the past. So just want to be clear that you cannot tell them to do anything that goes counter to what our regulation says already. You can only ask them to do things that are above and beyond. And so again, a lot of it will depend on what the actual incident is for, but like say there's a really high E. coli, that is actually, in some cases, it's built into the reg that they have to immediately tell everybody to stop using the water. I think particularly more for the smaller systems, but like say it's like a large municipal and they do a distribution sample and they get a really high E. coli, that's where the health unit might work with the operator to see if like, should we be putting an advisory on the whole system, or can we just do an advisory on a certain system, part of the system, based on the way that the piping is configured and the water flows. And then, yeah, essentially, like you guys are obviously, you're responsible for issuing advisories. So again, if it was like, say, some kind of really weird high chemical exceedance, then I would think that that's when, a drinking water, do not drink advisory would probably be put into place. So that's really the role, is basically, as a health inspector, do you think that there's additional actions that should be required of them above and beyond? And it could be also like additional sampling. If you look at it at what the result was and you're not comfortable with just one set of samples, then you can ask them to take more samples. That's part of your powers. So that's hopefully that answers the question and clears some things up. But if there's follow-up, happy to answer again.
Oh, that's great. This next question is really about the information flow and the disclosure for things that start with spills action. So spills action receives report, MECP inspectors collect data, the MECP lab tests the samples. Wouldn't it be more efficient for MECP to then disclose the results rather than rely on health units, and then let health units, chime in separately to speak to the health implications if and when there are any? So really just posing that question around the disclosure and flow of information, wouldn't it be more efficient to have MECP disclose findings?
I'm not sure if that's a follow-up from the blue-green algae sampling. I think broadly speaking, I'll try to speak sort of in focusing on the programs I manage. And blue-green algae being a specific one, because private wells are kind of unique. If samples are collected there, they typically are done in association with health units. So, but for blue-green algae, so the way it works is we receive a suspected blue-green algae report from a member of the public, or it could be from another agency. And then that's provided often to SAC. That's where we kind of suggest, because as Sadia mentioned earlier, they're a 24/7 service. So they will receive the report, triage it to some degree themselves, send it on to our officers in the districts as required to follow up. So then we do our own assessment, and it's a responsive program and complaint-driven program. So what happens is we we'll respond directly to the person who reported the suspected bloom in this case, or in other instances, it would be responding to the complaint about whatever it is that is of a concern. And then based on that assessment, we will determine whether we need to do a site visit, whether we need to collect samples, whether we need to do a bunch of different things. In the blue-green algae program, that's the same, works the same way. So we may go out and collect a sample if we deem it appropriate, and we may contact the health unit at that time to say, hey, look, we just got a report of a blue-green algae bloom, suspected blue-green algae bloom. We're going to go collect samples because it sounds like it could be a thing. And then, yes, we collect the samples, and again, we continue to notify the health unit, because I think the big reason that the health unit is being notified all the way through the process is because we do have that line in the sand where we're not able to communicate anything about health, like human health, to an individual or to the broader public, nor do we have the tools associated with that, the public health tools at our disposal. So once we receive results, we do typically communicate them to the complainant. They receive the information that we have collected, and then we more broadly send it out to these agencies so they can determine, do you feel that this is something that more broadly needs to be communicated to the public here? Because again, we don't have a mass communication tool typically in the same way that a health unit would. On the other side of it, which we kind of touched on earlier, is the more broadly just publishing data. And I think there are ongoing, as I mentioned before, ongoing conversations about that. I understand that that's something that some people are very interested in, other people are not very interested in. It's absolutely, I think there is value in being transparent and showing data where we can. So it's something that we're consistently looking at. And again, I recommend if for that program specifically, maybe this is a point of conversation that we can have in more detail at that sort of later seminar, as if time allows for it, for sure.
Right along. Noting that we are getting close to 11:30, we'll try and fit in, of course, one, maybe two more questions. For this one, it is about the Sewage Bypass Reporting Act. Some municipalities are not aware of the risks based on volume, length of discharge, and treatment level. They also may be unaware when and how they should communicate these events to the public. So the question, are municipalities required to conduct an environmental impact assessment under this act? And then if you could describe, please, a little bit about that.
Absolutely. So I can take this one. So just a little bit of background. The Sewage Bypass Reporting Act was a bill that was introduced in 2017. It did not proceed at that time. There's no new updates about it. So it is not an act. It's something that was proposed, but it is not current. So all of our wastewater treatment plants are regulated through, it's called an environmental compliance approval, and that is under the Ontario Water Resources Act, so the OWRA. Now, each treatment plant is unique, each treatment plant permission is unique to that treatment plant because there's different considerations, whether it's treatment technologies, whether it's where sewage is being discharged. All the ECAs are unique and they all have their own requirements. As part of their ECA or their environmental compliance approval, they're required to report their bypasses. If you're interested in finding the ECAs, they're actually available through Access Environment. I can provide the link after this so you can go and you can look. Now, kind of some updates from 2017. A lot of municipalities now have something that's called a Consolidated Linear Infrastructure, so a CLI ECA, and that is for their collection system. Now, as part of this new ECA, it talks about there's a requirement to post signage if there's any discharge locations within the collection system. So if there's combined sewer overflows, if there's any known sanitary sewer overflows, there is the requirement to do signage. If there are there's a threshold of discharge, there is a requirement to do different studies to ensure they find out the source and help mitigate these issues. So long story short, Sewage Bypass Reporting Act, unfortunately did not go forward, but look at the OWRA and the individual ECAs. Under the new CLI ECAs, there is a requirement for signage, and then under the individual ECAs, you'll see if there's a requirement for a report.
Wonderful, thank you. Okay, and with that, I'm going to just ask one more question, and then I promise to wrap on time so everyone can get back to their calendars for the day. When the MECP undertakes sampling activities, and this could be in response to maybe a cyano bloom or a spill, it could also be more routine sampling. What are some factors or characteristics that you look at to determine how long you'll have to sample for? So where repeat sampling may or may not be done, what is that time span? And how do you factor, or what do you factor in to determine that time span? Sorry.
I guess I can try to answer this one. This could be a pretty broad question. Cyano has a sort of specific connotation, as many of us are aware. I can speak more broadly about environmental sampling, so to speak. A lot of times, say at a district office level, they would look at, in coordination with their technical support services, so their hydrogeologists and surface water scientists, air technicians, and they would create a sampling plan as needed, whether it's for groundwater monitoring, surface water monitoring, which would pick locations, timeframes. Obviously, with air sampling, you can get into, the time frame. Literally, is it a 24-hour sample? Is it an 8-hour exposure sample? It's so broad, and we have sort of technical specialists that assist the frontline staff in identifying what that would look like. For something like cyano blooms, typically, as I mentioned, it's a response-driven thing for us. So we're not actively collecting information on the blooms. The only information we are collecting is to support weather advisories or health, so basically to support health units with their decision-making process. So once we've identified a bloom is present, we don't typically do follow-up sampling unless there is a specific request, or in some cases, if there's a significant change in the circumstances or the quality of water. So I can't think of, maybe a good example is if, Lake Erie a number of years ago, where you see a really significant bloom. We'd already identified it's present, but all of a sudden it's significantly worse. We might go back and resample just to get a, more current understanding of the level of cyanotoxins in the water. But normally that's not something we commonly do. It's sort of only on an as needed basis, versus other programs we might actively choose to do resampling or ongoing sampling, depending on what the contaminant is, what the concern is, whether there is a need to do repetitive sampling to get an understanding of trends over time. So it varies highly based on the program and the objective you have.
Thank you. Thank you so much, Dustin. With that, and with the time, we are now going to conclude today's session. I would like to extend our sincere appreciation to everyone who has joined and participated this morning. We are so very, very grateful for all of our colleagues at the MECP for taking time to share their expertise and their insight. And also a thank you to those at PHO who participated today, Dr. Tamara Wallington for her thoughtful opening remarks, our capacity building team for handling logistics, and my EOH colleagues, James Johnson and Tanya Lalvani, for all of their efforts in planning our April webinar series. As a reminder, our upcoming webinar on risk communication will take place on Friday, April 25th, with registration opening next week. We hope you'll be able to join. And I believe we're sharing the save the date slide for that right now. Following today's session, you will receive a brief anonymous survey. We encourage you to take a few minutes to complete it, as your feedback is invaluable in helping us strengthen our future programming. As mentioned at the start of today's webinar, we're using today's evaluation survey as an opportunity for you to shape future in-person workshops. Your input is greatly appreciated. Thank you once again, and wishing you all a wonderful Friday.